Good evening. Thank you for joining us at the first of our 5-part series, Flatten, the Curve of Inequality. Each webinar will address a different social justice issue and its intersection with the COVID-19 crisis. Tonight, we will hear from a panel of extraordinary leaders. They're all women, they're all people of color. So we will have the benefit of both their subject matter expertise and their lived experience. So let's get to it. But before we go, there are a few notes I'd like to share with you about how our evening will be structured. First, please know that this webinar does not have Spanish or ASL interpretation available. We apologize for that. We hope to be able to offer this service in the future on subsequent webinars, and more of that will be shared soon. If you look to the bottom of your screen, you'll notice a few features that may be helpful to you during our program. If you have a question for a panelist, please submit that question using the Q&A button. If you will, please include to whom your question should be addressed. While we'll do our best to answer all questions during our 2 question and answer periods, we may not get to all given the time constraints. Please note that there is a chat box. Messages sent to the chat box will be seen by the panelists, but not by other participants in this webinar. You may want to send affirmation or commentary. We welcome that. And please do so in the chat. Please do not submit your questions to the panelists in the chat. However, if you have technical difficulties, we welcome you to pose your tech questions there. We have a staff member who may be able to assist you. Again, questions for the panelists, please use the Q&A button. And we're going to have 2 breaks for questions, and we'll have an audience check-in after we hear from our first 3 panelists. That will be about the 35-minute mark, and then we'll have another longer Q&A period after we hear from our last 3 panelists, and that'll be about the about 6:45. And lastly, tonight we won't be using the raise hand feature. So with that, it's my pleasure to introduce our amazing lineup for this first webinar. We are here tonight with Joanne Fields, Government and Public Relations Director at the Asian Pacific Islander Initiative. Joanne is an incredibly active and engaged advocate, providing a voice for Filipino Americans and other communities of color in our region. She is the founder of the Lumpia Lunch Club, a Filipino American professionals network that meets monthly to raise questions of concern and concerns with local decision makers and leaders. Joanne coordinates the Filipino COVID-19 task force. Welcome, Joanne. We also have with us Christy Hill, the ACLU of San Diego and Imperial County's Deputy Advocacy Director. She is a San Diego native and has worked in California, Washington, D.C., and New York, advocating for the rights of women, children, and low-income communities. She is active in her community and helps to oversee the affiliate's policy advocacy work. Thank you, Christy. Welcome. Genevieve Jones-Wright is Executive Director of Community Advocates for Just and Moral Governance, MOGO for short. She was raised by her mother in a low-income home in Southeast San Diego, where devotion to family and self-respect were cultivated. In keeping with her goal to carry the bag of justice, Thurgood Marshall, Genevieve obtained a JD from Howard Law after graduating from the University of San Francisco with a BA in Mass Media Communications. She obtained an LLM in Trial Advocacy from California Western School of Law and proudly served as San Diego County as a public defender for 13 years. Welcome, Genevieve. Nancy Maldonado is Chief Executive Officer of the Chicano Federation. Nancy joined the Chicano Federation as the Senior Program Director in 2017 and has an impressive background in community-based research and experience in leading strategic development of community-based programs and interventions. Thank you for joining us, Nancy. Welcome. The Honorable Monica Montgomery, Council Member for the City of San Diego, also known as the People's Council Member, grew up in the 4th Council District that she now represents. Councilmember Montgomery serves on several committees, including as chair of the Committee on Public Safety and Livable Neighborhoods and vice chair of the Committee on Economic Development and Intergovernmental Relations. Thank you for joining us, Councilmember Montgomery. Welcome. The Honorable Akilah Weber, MD, Council Member for the City of La Mesa, a native San Diego. She graduated from Gompers Secondary School. By age of 26, Dr. Weber had received her bachelor degrees from the Xavier University of Louisiana and her medical degree from the University of Rochester Medical School. In addition to serving the people of La Mesa, Dr. Weber serves as director of the Pediatric and Adolescent Gynecology Division at Grady's Children's Hospital in San Diego. Glad to have you with us, Dr. Weber, Councilmember Weber. I'll switch between the two of them because I like them both. Thank you for joining us. So every panelist is going to get the same 2-part question and then asked to expand on another question. So I'm going to ask Councilmember Montgomery, you first, the first part, and then the other question we'd like you to answer, and then I'm going to shut off my mic and you'll have 5 minutes to respond. So we've seen protests and civil unrest in our region and across the nation over the past several days. Tonight's conversation will focus on securing racial justice and equity during the devastating COVID-19 crisis and its aftermath. But we would be remiss not to offer space for acknowledgement of and reflection on the tragic killing of George Floyd in Minneapolis and the rippling effects it is having nationwide and here at home. So here's the 2-part question. What is one lesson that you see for our region and our nation in this moment? In what ways have racial justice and equity been centered in how you have responded to the COVID crisis in your work, and then the overlay of what we see happening to us today? And then the other question for you, what does it look like to advocate for racial justice and equity during a pandemic? Thank you, Councilman.
Thank you, Cheryl. And I want to thank you all for inviting me to be here with you this evening. I think the one lesson that San Diego can learn from this is that Black people were right. We have experienced trauma in this country since we've been here. And we are always dismissed. And I think that now, because we had to experience such an excruciating death of a Black man over the course of 8 minutes and 46 seconds, it's really triggering a lot of enlightenment, unfortunately. But had the camera not been there, he would have been another Black man that died at the hands of police. And so we need to understand and trust Black people in this moment, and continuing on as we move to the next level, whatever that is, of our nation. That is the one thing that San Diego can learn. We have the data here in San Diego. We look at it over and over and over again. And we just have not believed Black people enough to change the systemic racism that is within our city. Until now, I'm hopeful that this is the time where we can begin to do that and have a true change in our city. But that's the one thing that I think that we need to learn from this, that not only it's so tragic for George Floyd, but it's tragic for many that have even died in our own region. It is really easy, it's easier, let me say, to look across the nation and see something horrible and speak on it. But these things have been happening in one form or another in our own region. And so that's the What does it look like to advocate for racial justice and equity during a pandemic? It is very tricky, and from my perspective, I'll tell you why. Politics is oftentimes about who can grab a headline. In this pandemic, I have taken an approach of taking what we already have and trying to distribute and use that so that the people can eat, so the people can get by in this really unfortunate time. I represent a district that is one of the top 5 parts of this region that is experiencing the most unemployment. So although it can be tempting sometimes for us as politicians to try to get out in front and put our name on something, the most important thing right now in leadership is to do the work. And in our time now, if it's not on social media, then it didn't happen. Well, I'm not going by that, because there are people that need help every single day that none of us ever see. And that's who I'm choosing to help. And that's how I'm choosing to lead during this pandemic.
Thank you, Councilmember Montgomery. To Councilmember Weber, same 2-part question. What is the one lesson that you see for our region and our nation in this moment? And in what ways have racial justice and equity been centered in your work, and how you've responded to the crisis, both as a lawmaker and also as a physician? And then the same question as directed to Councilmember Montgomery, what does it look like to be an advocate for racial justice and equity during a pandemic, and overlaying on that during the present crisis that we're in?
Thank you very much for having me. I was thinking of this the other day, and I think, for me, the one lesson that I would say that we all need to learn in this country, people talk about if you don't know your history, then you're doomed to repeat it, right? But I would take that a step further and say that if you don't know your history, or you don't learn from your history, then you're doomed to repeat it. And if you don't acknowledge your history, then you're doomed to repeat it. And that is one thing that this country has never done. It has never really acknowledged all of the things. I will often talk about the sins of the past. And because of the fact that they have never really acknowledged all of the hurt and harm that they have done to Black people, to Native Americans, to Hispanics, they have never had any kind of reparations for that. And because of that, we continue down the same saga. Every generation, every few years, we're dealing with the same thing, same topics: racial inequalities, police injustice. And because we have never grappled with it as a nation, because we have never accepted our responsibility as a nation into what has been done, we have never been able to address it, accept it, nor repair it. And so I think that this is a good time for everyone to sit back and say, this is not the time to sweep this under the rug. It's not the time to think that these people will protest and then eventually it'll go away. This is the time to realize that what we're seeing now is not because of this one particular incident. It's because of things that have happened over and over and over again for years and generations, and it has never been addressed properly. And until it is addressed properly, we as a nation will continue to deal with these same issues over and over and over again. Our parents didn't think that we would be dealing with police brutality. Our grandparents wouldn't think that we'd have to be dealing with this same thing, but we are. And if we don't get this right this time, then our children and our grandchildren will still be dealing with it as well. So that is, the one thing that I hope that we learn from this. It's not going to go away. We need to address it. And then if we want things to get better, then we have to acknowledge it, address it head on, and then figure out how we can repair it. It's been a tough week plus for those of us in La Mesa. But again, that goes back to what I just said about if you do not acknowledge your history and learn from it, then you're doomed to repeat it. We had a similar incident in 2018 with an officer that, mishandled a student, was aggressive with a student, did not know how to de-escalate a situation very well. And that situation was not handled correctly. And so then we turn now to 2020 and we have a similar situation, actually worse than what we had before, because now we have more than one incident. So, for me, I have been advocating for, police reform, focusing on racial inequities within an amazing city, but a city who has never really wanted to address it before, who has never really said that this is a problem and we need to figure out how to fix it. And right now what we're seeing is this is a problem. It showed up before, it has shown up before, we didn't fix it before. And if we don't fix it again, this time it will come back again. And I am happy to be there as a voice to remind people where we need to be focused, where we need to be working, the things that we need to be fixing so that we don't get off course again and in a year or two end up in the same situation.
Thank you, Councilmember Weber. And when we get to Q&A, I'm going to circle back and ask you if you might share some of your thoughts about health disparities, specifically from your expertise in that area. And so Nancy Maldonado, same two questions. What one lesson do you see for our region and our nation? And in your work, how have you centered racial justice and equity? And then for your second question, what are your concerns about the way we're opening up the state and the region, in particular, South County? And what issues of race, what are the issues of race and equity that might be overlooked or underappreciated?
Well, yeah, thank you for having me. I feel honored to share this platform with such amazing leaders. So one lesson that I think that I see for non-African American folks, that in this moment, it's a time for all of us to really pause and reflect on how each of us can be better and own up to the times that we have failed to call out racism and name white supremacy. I think it's easy to be reactionary in this moment and say, oh, no, that's not me. I'm not racist. But this is a moment where each of us can dig deep and identify the times that we have failed to call someone out because they were a friend or a family member or a donor or an elder. And it's important, this is an important time to identify the biases that are within each of us because we all have them. And I think it's a time for all of us to reflect on solidarity and on allyship and really understand what those two words mean for each of us as leaders, as organizations, as mothers, as community members, and really understand how we can put those into action. I mean, like all of you, I've been inundated with statements of solidarity from different organizations and companies, but quite honestly, some of them fall short of naming the problem. So I think that the lesson that can be learned in this moment is that in order to change something, we have to be willing and ready to identify it and name it. And to your second question, and advocating for during this pandemic, I mean, obviously it's amplified the concerns that we've had for a long time, and it's laid bare the racial and economic disparities that have existed in our county and our country for far too long. And when we look at the infection rate in our Black and Brown communities locally and across the nation, we are witnessing the devastating consequences of historical disadvantages and disparities that have been in place for too long. And we all know what those are. I mean, they include health, education, housing, food security, technology. I think even more granular than that, when the issuance of the stay-at-home order went into place, it really raised questions about the practicality of advising people to social distance or self-isolate when their housing conditions make it impossible for them to do that. And it raised the question of the overrepresentation of people of color as frontline workers and them being at higher risk of exposure. And if we want to talk about pre-existing conditions, we can't ignore what has contributed to the pre-existing conditions, right? The access to the lack of access to healthcare and affordable housing, the food deserts, redlining, gentrification, the poor air quality, the environmental conditions. I mean, the list goes on. So really the bottom line that we've been advocating for and, trying to help people understand is that income inequality is a pre-existing condition for COVID-19. And we're seeing this, to your third question, in South County, and the staggering infection rates in South County, and that we have failed to see a real plan of action for what's the plan for this infection rate in South County. I mean, we're seeing astronomical numbers, and we still don't have a plan in place for how to address this high infection rate, and more importantly, how to address the disparities in moving forward. And so, that's really been what we've been advocating for, and making sure that as this reopening happens, that the voices of our community members are elevated. We're hearing the voices of business owners and elected officials, but what about our community members that are on the front lines of this reopening? We have to elevate their voices and really take their concerns to heart, because they're the ones that are at most at the increased risk.
Thank you. Thank you for that. We are going to do our first audience check-in. This has been a great discussion thus far. We've got some questions that have already percolated up, but I'm going to take the privilege of moderator and ask the first one that I had indicated I wanted to ask before. Dr. Weber, can you take about a minute and tell us what we should know and be concerned about regarding health disparities that are exposed or exacerbated during this crisis?
Thank you very much. Of course, yeah, I can. So, I mean, we just heard about some of those, the fact that, minorities have a higher rate of hospitalization, higher rate of ICU admissions, higher rate of mortality or death overall throughout the country. And I think here in San Diego County, we can sometimes not focus on that as much, because when you look at our overall rate of deaths from COVID, it's pretty low when you compare it to other cities throughout the state and other cities throughout the nation. However, when you and the number of cases or percentage of cases within Black and Brown community are low, especially when you look at African American numbers. But one of the things to keep in mind is that when you look at the specific rate of African American numbers of COVID cases, comparing it to the overall number of African Americans in San Diego County, we have a pretty high rate per 100,000 people. So when you look at Black or African American, our rate is 161, Hispanic is 356 compared to white, which is 90. And these aren't things that we talk about, right? And so it is extremely important that we as communities of color take this very seriously, that we learn how to advocate for ourselves. We talk about testing sites. I always found it very interesting, and I question why our initial testing sites were opened north of 8 instead of having some that were south of 8. It took a while for the one south of 8 to be opened. And so I always found it very interesting that you can go and get your testing done in La Jolla, but if you lived south of 8, you couldn't do that until they started looking at the numbers and they said, oh my goodness, there's a lot of people in South Bay that have it. So let's open up one there. So, we have got to be advocates for ourselves when you go into the hospitals. I spoke to someone today who's African American who tested positive for COVID. They didn't want to test him, right? He went in for symptoms. They did not want to test him. So we have to advocate on behalf of our communities, and our community members have to know that they have to advocate for themselves. Because right now people like to lump everything together and try to pretend like there isn't any kind of racial disparity, especially within San Diego County, but there really is.
Thank you. Can you hear me better? It's a shout out and a question. And I'll read it as she posed it. This is from Chris Hannah Smith. She says, when I was younger, I was a part of Elite with Genevieve. That was a safe place from the community we grew up in. Now that I'm older, I work at the Chicano Federation preschool for low-income and at-risk children for Nancy. I advocate for children. So I'll pose this question to anyone who cares to answer, open it up to all the panelists, but certainly since we called out two, I invite the two of you to answer first. The question, what can we do to stop fear and promote self-love in our children? What can I do with the children I work with to end the fear they have of police officers? We'll take that for, well, Genevieve, why don't you take that first?
That's a very, very heavy question. I think that going back to something that Nancy talked about is just being honest. I think that we have to acknowledge that the fear is real, but we have to encourage our children not to stay in that fear. I think that with this particular crisis, we have great opportunities for police reform. And a part of that is changing recruitment efforts so that we can have officers that look like our children in our neighborhoods. We need to absolutely heal this divide. I struggle with the language of restoring trust when I'm talking about the reforms that are needed, because in some communities, I recognize we've never had trust between community members and our law enforcement community. So we need to establish trust in a lot of communities. And that does begin with our children, but we have to acknowledge that we are living in very fearful and scary times. And one thing that I know to be true is that children see what we think they do not see. And it is usually out of the mouths of babes that we actually hear the truth come out. And so we have to be truthful with our children, even if it could be painful having those conversations, but to name it and empower them. We have to empower our children, and we have to involve them in the changes that we seek so that they understand that they have to be the change and work for the change. But I really do think that all of this is going to take us coming together. And so for our children to see that officers are human, just like they are, and we have to see the human side of every person in our communities. And I think that will go a lot further. And that's just one step, but it's a very big part of the steps that need to be taken. It's about changing hearts and minds. And it's really hard to fear someone that you've come to know. It's really hard to hate someone that you've come to know. And we really got to get to community policing and involve our children in those efforts.
Thank you. Nancy, did repeat the questions if you like?
Oh, that's okay. I mean, the only she said it perfectly. The only thing I would add, along those lines, is to give our children, to give our youngsters the tools to be able to name and identify what they're seeing and what is happening, right? I think too oftentimes in schools we want to teach kindness and then stop at that. And that's not enough, because it's not a matter of if, it's a matter of when our children will see oppression and discrimination. And we have to arm them with the tools to name it and disarm it. And so I think it has to go a step further and empowering them so that they know what to do in those situations.
This is a question from Bryce Ekimura. And so as I pose it, please know that it's not that I actually expect you to be in anyone's mind, but I'm going to read it as it's written here. And I will direct this to Councilmember Montgomery. How can we best explain the mindset of looters and rioters who feel that these methods are the most effective way to bring awareness to this issue to folks that disagree fundamentally with the ethicality of stealing, vandalism, etc.?
Well, that's a good question. It's complicated because, first of all, there has been a question across the nation as to what different groups are doing, the different activities. So we don't know that for sure. We have heard there's been infiltration and things of that nature, but also right here in the county, some of the activity has been exacerbated by the attack of peaceful protesters. So that has to be a part of the conversation, that instead of folks reacting and going home, some people have decided to go further and destroy property. I don't know all of the details, but what I do know is that we have to focus on why there are protests across the nation for 10 days straight. And we cannot lose sight of the reason why folks have decided to finally come together and address this. We have had many different forms of protests leading up to this, and all of them were unacceptable to the larger power structure. And so until we deal with many of the disparities that have already been talked about through our panelists today, and also our original sin going back 401 years ago, we will see this erupt in our country as we move forward until we deal with that. And so that explaining it, we can't always explain the activities of others, but we can focus on what the problem is and why we have folks in the streets in the first place. And that is because the majority of us have seen a video where, again, a man, his life just was taken out of him, and we all saw that. And so we have to focus on what the real issue and the roots of the problems are. And it's just like Nancy said, a lot of the allies are coming together, and we truly appreciate that. But we have to address systemic racism. And so until we do that, we will see more of these activities.
Thank you, Councilmember Montgomery. Councilmember Weber, if you want to add any more to that, I invite you to do so, but I have a second question for you. This is from Tony. Are relations with police departments good enough that they would be comfortable asking community leaders to speak in front of protesting crowds, to address concerns, any reason to be hopeful for improvements, and request that protests involve nonviolence from both police and protesters? The first part, are relations good enough?
Are relations with the police department good enough that they would be comfortable asking community leaders to speak? I think that it depends on the particular city that you're referring to. So I can, speak, of course, to the city of La Mesa. I think that in the city of La Mesa, as far as the relationships between the police department and what we would consider the community leaders in La Mesa, I do think that they are good enough that they would, that the police officers would feel comfortable, if they thought of it, to reach out to community leaders to come out and talk to protesters, depending on who the protesters were. I mean, in La Mesa, unfortunately, we had the situation where there was one group in the daytime and a different group in the evening time. So, I think it depends on the city, and also it depends on who is actually out there. If you're actually talking to members of the community, or you're talking to people outside of the community.
Thank you. This one, again, to both council members Montgomery and Weber. This is from Chevelle. As the only Black council members in your cities, have you found it difficult to navigate your work during this time? And what are ways you have coped? Why don't we start with Dr. Weber, and then we'll go to Councilmember Montgomery.
Well, I think it's always a challenge when you are the only one. And I think it's always challenging when you are the first one. And that is when you rely on other members of the community to help you in your concerns and your issues. You know, I know for me, it was not easy getting the rest of my council members to get on board with establishing a police oversight commission. But, you know, luckily I, you know, went to the community, and there were enough community leaders and also community organizations that came and spoke and helped, you know, really push my fellow council members in the right direction to get on board with it. So it's not easy, but, you know, utilizing the tools that you have with other community leaders and organizations has definitely been a benefit to me.
Thank you very much, Councilmember Montgomery.
Yes, I would definitely agree with that. I feel like there are many different dynamics that I could go on forever about this, and I won't. But since day one, I felt like I was carrying the community with me every time I walk into City Hall because of the way because of how we made it there. And so for me, that is an honor, a privilege, a burden that I want to bear, because that voice has not really been heard inside those walls for a very, very long time. I have definitely allies as colleagues, but there is still the system of structural, there's racism, and there's still white supremacy, and there's still conditioning. And oftentimes we communicate in those spaces without even realize what we're doing. And so every day having to fight that is really a challenge. And if you are really trying to do what the people need to be done, that puts it, because I'm just gonna say this, being Black is one thing, being Black and really doing things for communities of color that have been underserved, underfunded for decades is quite a challenge, and it is tough to navigate that. And so we continue to do it. The other part of it is, I spoke a little bit about this in the introduction, but it's politics. And sometimes you realize why people who want to do the right thing don't get involved because there is a lot of maneuvering. And you have to really deal with that without losing the core of who you are and your values. And so it is challenging, but we're up for it. We're up for it.
Thank you. And thank you, Nancy, Councilmember Weber, and Councilmember Montgomery for your comments during this first period. We're going to go to our second period, but we'll still be circling back a little bit later to ask questions of all. Thank you. To Genevieve Jones-Wright, the first part, what one lesson do you see for our region and our nation in this moment? And then in what ways, this is an interesting one for you as you launched a new organization, in what ways are racial justice and equity centered in how your organization does its work in the midst of this crisis? And then the other question I'd like you to tackle for us is non-government organizations and ordinary people have been coming together to take care of each other in ways where our government has fallen short. And how do you see this coming together in the communities that you are a part of and serve? If you would unmute.
Unmute. One lesson in a nutshell is that now is the time. Now is the time for us to move forward to get us to a place where we are actually a decent society that is rooted in the recognition of common humanity. Our lesson right now is that we cannot go back. We cannot stay the same. And we cannot even go back to 2016. We can't go back at all. What we're seeing, all of this unrest around the country, is not just about Mr. Floyd. It goes all the way back and prior to Emmett Till, to our ancestors, to the violence that has been exacted upon Black people in this country at the hands of our government. And this is the time to move forward. Councilmember Montgomery talked about the studies. We've had enough studies to validate what Black people and people of color have been saying. In San Diego, we don't need any more studies. We don't need any more statistics. We have them all there. We have enough anecdotal experience. We have too many stories. Our list is growing longer and longer of names of people of color who have been unlawfully killed at the hands of police officers. That was done in impunity. So we cannot go back. So the lesson is seizing the moment and seeing the opportunity in the crisis at hand. Now, I launched that nonprofit, MOGO, Community Advocates for Just and Moral Governance, as Cheryl referenced. And we actually formally launched on March 7th as the co-founder of this organization. I had no clue that 4 days later, we would be launched into a global pandemic. This changed the entire course of our work. We knew that we were coming in to respond and address inequities in police practices. We knew that we needed to make systemic change through various forms of advocacy and litigation. But I never imagined that I would be filing petitions in the California Supreme Court because of the public health crisis that is mass incarceration. And I will talk about that a little later when I have more time, but it has really changed the work. We have been making sure that community members who are experiencing inequities in testing get the testing and advocating on their behalf. Our frontline workers, the majority of frontline workers out here serving us, helping us, assisting us, waiting on us, are Black people, and they are not given the proper protective gear. So we're out here advocating for that and changing all of those things. We are boots on the ground in the community, and we are more than happy to do it. But I never imagined the work we would be doing as an organization being rooted in COVID-19. And I did not remember the third part because it was a lot.
You actually kind of covered it. I asked, what ways are you seeing these things happening in the region and the communities that you work and serve in? So, but thank you so much. Same question to Joanne Field, same set. The initial questions, what one lesson do you see, Joanne, for our region and our nation in this moment? What ways are racial justice and equity centered in the work that you do? And can you talk about how non-government organizations and ordinary people are coming together to address issues where our government has not stepped forward to fulfill its rightful role?
Okay, thank you for having me. Thank you for the questions. So the lessons that I've seen locally and nationwide is the Filipino community is still far behind from everyone. There are no studies. So when I heard David say we don't need studies, we don't have any studies because there's no disaggregated data. So our fight is centuries behind all of you. And it's so frustrating that we're so far behind because we are lumped in a group under an umbrella called Asian and Pacific Islanders. And like you've heard me say at the Women's March and many meetings, people do not understand what that umbrella really entails. Pakistani, Bangladesh, Thai, Lao, Korean, Vietnamese, Japanese, Chinese, and Filipino. Native Hawaiian, Samoan, Chamorro, Tongan, all are under that umbrella. And I see someone post Iraqis and Arabs are under that umbrella as well. And I know there's more that I didn't mention, but those are just off the top of my head. So when it comes to COVID-19 and you see the numbers, it's not true numbers, at least not in my community, because when you look at my name, Joanne Fields, depending on who's doing the intake, you might label me as white or Black. Susan De Los Santos, the publisher of the Filipino Press, De Los Santos, you might think that she's Latino. And depending on who you're talking to in the Filipino community, they may claim Asian or they may claim Pacific Islander, because we are 7,000 islands in the Pacific. So with all of that, our numbers are skewed all across the board. And when we look at the pandemic numbers, the higher number of cases are in the South Bay, especially 92154. That's the zip code I grew up in. But again, with what I have just mentioned, we may be included as Latino, we may be included as Caucasian or Black or Asian or Pacific Islander if we're identified. And if you look at the county's daily report, the higher number is unclassified, not identified race or ethnicity. So when we're trying to address COVID-19, we need to do that multi-prong, and language is one of those ways. So if we are not conveying emergency announcements in language to our whole community, not just one community or a few communities, I invite you to look at the COVID-19 website on the county's COVID-19 website. There's pieces of information that is translated in many, the majority of the languages spoken in the county, according to the US Census Bureau. But then there's other pieces of information, videos, resources that are not. So where does that warrant? What makes you translate in one language versus another? What piece of information is more important than the other? And it's hard to advocate for that when you don't have the numbers to defend your need. So when it comes to the COVID-19 pandemic, it just amplified how far behind we are locally, statewide, and nationally. So, which leads me to the second question. So how does it look like to advocate for racial justice? Another organization. How to create another organization. Because of the work that I've done over the past decades and outreach, we know we have the Albondigas in the Latino community, Catfish Club in the African American community, and now we have the Lumpia Club. But as we move forward talking about COVID-19, it has evolved now to creating a task force. We have the Filipino COVID-19 task force, because guess what? A lot of task force were getting created and we were not at the table. So I'm not gonna wait for an invitation. We're gonna create our own table and we will advocate. So I think that's my time. Thank you, Cheryl.
Excellent, thank you, Joanne. To my colleague, Christy Hill, same two first questions. What's the one lesson our region and our nation can take away in this moment? In what ways are racial justice and equity centered in your work? This would be an example of it, so maybe you'll skip that one and talk about this next one. Some cities and counties are taking bold action, have been taking bold action to slow the spread of the virus, like releasing people from jail, or to mitigate some of its economic impacts. That would be like eviction moratorium, rental assistance programs. Can you talk about how these emergency actions help to address concerns of racial equity, racial and social equity?
Yes, thank you. So in terms of the lesson for this moment, following the killing of George Floyd, along the same lines as Genevieve said, that we cannot accept incremental change. That's not enough in this moment. We need bold solutions. We have known research-based solutions that reduce police violence in communities of color. But what has been missing is that there aren't enough leaders willing to act on them. Folks are more concerned about what the police union's gonna say versus the Black and brown lives that have been lost. And so that has to change, right? This week, in the last few days, we've heard a lot about carotid restraint bans being passed. And we are grateful for the leadership of Councilmember Montgomery and Council President Gomez in taking and pushing for action and not just calls for peace to ensure that that happened, and listening to community members that have been advocating for that. And yet we know that it's not enough for the police chief to say that he won't choke us. That's not where this ends. And we deserve more. We deserve to be able to breathe without being worried about being racially profiled and stopped or killed. And so for me in this moment, it's that I want to see in our region in San Diego and across the country, action taken to really implement the solutions that take, that divest away from law enforcement solutions and into community-based solutions, so that when we have mental health crisis in our community, it's not a police officer that's responding, it's a mental health clinician. That we are reducing when police are stopping folks. So to really see bold change come, that's one lesson. And then in thinking about the pandemic, while all of this is going on, we're in a global pandemic, right? And it's just trauma upon trauma, in that pandemic is also affecting Black and brown communities at disproportionate rates. And so in our work at the ACLU, one of the ways is just to make sure that narrative isn't lost. And so doing series like this, like you alluded to, Cheryl, but also we have been working in partnership with community members and coalitions to advocate for things like, pushing cities and the county to invest in emergency rental assistance funds, because folks lost jobs, right? We know that 1 in 4 people in San Diego are unemployed as a result of COVID. And that has impacted, certain communities harder. We also know that people's rent can be increasing during this time. And so passing measures like rent control. And so we're proud to be a part of Invest in San Diego Families Coalition, where we're advocating at the county together to push for these measures. These are solutions, again, that we know work and that people need. Even before the pandemic existed, folks were struggling to make ends meet in San Diego. And so these solutions that now are being implemented are things that we should continue. The calls to release folks from our jails and detention centers, because you can't socially distance in a jail or detention center, right? To release those that are high at risk for COVID, folks that are in for low-level offenses. And in places that have done that, we have seen there hasn't been an increase in crime. And so these are solutions that will work during a pandemic and outside of. And so as we move forward, whatever it looks like post-COVID, whenever that is, I hope that, cities and the county will continue to leave measures in place to build up on those measures, because we have learned that where there is a will, there is a way, and that things that for folks have been fighting for years that we were told couldn't happen in a matter of days, right? They will find money when it matters and when it hits them. And you talk about reopening, and once the data that they decided to share started showing that it was hitting Black and brown communities more, I don't think it's a coincidence that now we want to reopen faster, because the folks that have to show up to work are folks in low-wage jobs. Our essential workers are by far and large Black and brown. And we have also been joining in the call to push for data to be shared, because just as what's being shared, it's also what's missing from the data. So who actually has access to tests? How many Black people are getting tested? We don't know, right? And you can't manage what you don't know. And so that's where our advocacy has been centered with partners. And we are looking forward to continuing to work with partners to push the county to ensure that their response is centered on equity and racial justice.
Thank you. That's my colleague. Thank you, Christy. So can everyone on mic, let's have a conversation. I want to throw out a question that Carlotta Kirby has raised. I'm waiting for you all to unmute our panelists so that we can talk about this. And here is her statement and then her question. There's been much advice and direction provided for the white community to step up and aid in promoting and aiding in the fight toward bigger and better change in the fight for racial justice, such as donating, educating themselves and others, speaking up and the like. What can be done specifically and locally in the community of San Diego, and I would consider that the broader San Diego, Dr. Weber, given that each community is different and faces different hardships? Joanne, why don't you kick us off? Because I think, kick us off, but be brief, because I think that was one of the things that you were pointing out, that we are much more, we have challenges around our differences as well.
Yes. So I want to point to testing. So we want to get tested. Almost 20% of the workforce, healthcare workforce, is Filipino, whether they're nurses, doctors, transporters, in a hospital or nursing facility. In East County, Victoria's, the nursing home there, 14 patients died, 42 positive cases. Testing for staff, they're not testing. They don't have the same training as you would in a hospital. So, and that's just the workforce. And when we look at lower level nursing, so the CNA, the LVNs, they work in more than one facility. So you're going from one facility carrying the virus, potentially, because we don't know, because we're not tested. Testing is not happening in our community. So again, the advocacy needs to be looked at in a different lens, or just be aware. And that's why I do appreciate that we're having this dialogue, because people may not aware, hey, we're talking about South Bay, but you need to go further south to 92154, where the largest number of cases of COVID-19 is taking place. So we need testing there. There isn't any right now. So the data, the locations, the access points need to be looked at different lenses. And I think this dialogue is giving us that platform.
So Nancy, what can white folk do? Caring white people, what do they need to be about in this moment?
So, yeah, I'm not sure that the question was related directly to COVID, so I think I'll answer in two parts. You know, for us on our platform in the Latino community, one of the things that we've been doing is really addressing the racism that exists within our own community and the colorism that exists within our own community. And even as far as calling out our Spanish-speaking media for their, quite honestly, terrible reporting on what's going on. So really looking at ways that we can use our platform and looking at ways how we can be allies right now, but doing the work within our own communities, I think is something that we can do as non-white folks. But also, you know, as it relates to COVID, I think that, you know, digging deeper into the infection rates, into the underlying factors that are related to the infections, and gathering more information from the individuals that have been infected, so that we're able to identify and address the underlying factors, right? I mean, the economic disparities and everything that goes along with that, so that we can make changes post-COVID to address some of these. We can't just leave it as, you know, this is the infection rate. We have to dig deeper, and we have to do more work so that post-COVID we can address these, and we can come out better, and we can make the changes that are needed to address these inequities moving forward.
Okay, who else? What can white folk do, Genevieve?
I'm going to always tell you to donate your money. If you don't have time to volunteer, we have so many things that can use financial resources. I'm a very big proponent of the ballot measure for an independent and community-led commission on police practices. It is going to take money to make our community aware of this being on the ballot once it gets placed on the ballot. And so donate to San Diegans for Justice. Go right there to www.sandiegansforjustice.com. And along the lines of what Christy talked about, I'm also a big proponent of taking law enforcement from the front lines and being the face of how we address the needs of the community where it should not be law enforcement. We need to donate and give money to community-based organizations that are already doing the work. Now, I'm also going to say our city needs to also reallocate those funds as well, but we can do our parts as community members by helping these community organizations, especially now during this time, to aid in the work. And so I am going to plug my organization, MOGO, www.moralgovernance.org, because we are doing the real work and it does take money, and we don't charge anything for the folks that we represent in court for all the things that we're doing in the community, in the trenches. And I will say that there's a community bail fund if you want to donate for some of the protesters who have been arrested. I will put that in the chat a little later, but there's always something you can do. If you don't have the time, but you have the money, give the money. If you don't have the money, but you have the time, we can plug you into many ways of volunteership, which does not necessitate you being on the ground. But
so what you're saying is come to community.
Come to community. Community always has the answers. We have culturally informed responses that the community needs to actually address the needs of the community.
So Dr. Montgomery, we've been here before. Excuse me, Dr. Weber. Councilmember Montgomery, Dr. Weber, we've been here before. This is not new. Councilmember Weber, you said, know your history. This is not new. And this is a question from Wadad Schlott, who asks, for the moment, it seems liberal centrists will oppose Trump. And what this person is saying is, we think things are going to be great because we have new energy, and then people are elected who say that they will support us and then they don't. But it is unlikely, Wadad says, that they will support the new political structure that would make a real difference. So how will you as policymakers ensure that racial justice will not be compromised post-COVID?
Well, I think that one thing we have not done a good job within the minority community, especially within the Black community, is that we have not always gone back and held our elected officials accountable, whether they're Black, brown, white. You know, it seems like they show up when it's time to be elected and then they disappear and they don't come back until it's time for re-election. And so we have to understand that if we want people to listen and not just get our votes, right? Because a lot of times they are elected into their office because of their votes, that they have to continue to do the things that they said that they're going to do, that they have to continue to work with us, that they have to put people on their staff that look like us, and they have to continue to meet with us. And if they don't, then they will not get reelected. It's not okay to just come around a few months before re-election. It's not okay to hand out a few awards in the community. You actually have to be present for your entire term. And we haven't always held people accountable, and that's what we definitely need to do. And before I turn it over to Monica, I just wanted to briefly touch on something that Joanne said with the last question about testing for COVID. Testing is extremely important because if you don't test, you don't know the accurate numbers, you can't trace, and we can't treat, right? And so with testing, we can't just look at medical workers because we have a lot of what we consider essential workers that are outside of the medical profession that are also being exposed to COVID potentially. And so we need to ramp up our testing so that we're not only testing those that work in the hospital, but people that work in grocery stores or in the supermarkets or in other stores that we happen to go to are able to get tested without jumping through hoops. And if you tried to get tested for COVID today, it would be very challenging. You have to figure out where to go, make an appointment. Sometimes they don't want to test you because you don't have the right symptoms. That should not happen, especially if you are an essential worker, even outside of the medical community. And so we know that a lot of minorities are essential workers and that they have been working throughout this whole time. And so people need to advocate for more testing of everyone.
Yeah, I'm in agreement with you, Dr. Weber. And I only brought that up is because we have families that are multi-generational. So if that one potential carrier, and we're not getting tested as an essential worker or a healthcare worker, and you bring it home and they're not tested, I know I requested for testing. There was a certain elected official that said, hey, we have free testing. And yes, it was north of 8. And when I called, I said, I was in a hot spot. I was in Chicago trying to come home, and I've been exposed to international travelers. And they said, well, if you didn't travel out of country, you're not affected. So therefore you don't need a test. And I'm around my parents who are of the vulnerable age. So I asked, well, can they be tested? They said no also. So I was so upset that I hear that there's testing available, but really it's not. Once you get screened, you had to be coming from China or that you were on a cruise. So that the whole story is not being told sometimes.
Exactly, right. And that's when you have to just keep pushing at it.
Excuse me, I beg your pardon.
No, go ahead.
Councilmember Montgomery, hey, we've been here before. How do we make sure that we don't get stuck in the same rut and having this conversation again?
And I think the way I heard the question first was also what are we as electeds going to do to make sure that we are staying close to the people? And I think, this political races and campaigns are very important, and people-powered campaigns are extremely important. Where people get their money from and their support from is very, very important, even before they get to office. Sometimes you can see the writing on the wall if you look a little bit at the history. So that's one thing, is to be involved from the very beginning and stay in the face of people who are running, who you support. Stay in their face all the way through. And that's one thing, that this is still about money and campaigns. That is a very important thing, because people tend to go wherever their money pot is going to take them. And in that, we have to really be people powered when it comes to voting, because if we vote, and the people that don't normally vote, if we vote, then we will have folks in those seats that represent us. That is very, very important. Voting shouldn't be an elitist privilege. It's something for all of us to do. It's sometimes a hard sell for people, because they've seen so many times people get to the seat, abandon the community. We've seen that over and over and over again. But I still do have hope that the people can put folks in a seat, and be held accountable to the people, not to necessarily to a party or to a certain institution within our city or state or nation or whatever it is, but to the people. So I think that's very important, that we start the right way. That is extremely important. Don't be bamboozled by a lot of talking points and what folks think is popular and what they want to hear. That's very important. The other thing is, I have to commend community groups that bring forward actual policy. Police reform is big, but I deal with I think I serve on like 11 different committees, everything from renewable energy to economics to housing to police reform. So, and with a staff of 9 people. And so we have a lot We have, stacks on top of us. And what other folks have learned is that, they're in our faces every single day saying, we need you to vote this way. And this is the policy. And I have to commend our community groups that are coming up, that are bringing those policies to us, because then that, you don't give us a choice but to do what we said we were going to do, right? So that is very important, that we build that infrastructure within our communities where we can advocate on that level, because other folks have been doing that for decades.
Thank you. And that's actually a great segue to our closing statements. And since Councilmember Montgomery, since you mentioned community groups, we'll start with our leaders of community groups. And each has been asked to give us an action item in their statement. So I hope those of you who are listening still will take note. We'll start with Nancy Maldonado. We'll go to Joanne Fields, then Genevieve Jones-Wright. And then we'll hear from our electeds, and then Christy will back clean up. Nancy.
Okay. So I think for action items, I think it's important that we start to call out companies and practices that are upholding this standard of oppression. So for our community, let's stop supporting the Amazons and the Home Depots and the Chick-fil-A's of the world. We know what they stand for. So let's stop funding this divide. Let's stop funding our own oppression. Let's start supporting local businesses, and especially businesses owned by people of color. And I think for our corporations, for our philanthropists, and donors, stop funding organizations that are not committed to social change. Stop funding organizations that are committed to maintaining the status quo, and start funding these community-based organizations that are ready to do the work and ready and committed to make some changes, some much needed changes. And I think for leaders and individuals, it's time for us to use our platform in whatever capacity we have and commit to dismantling these systems that are rooted in oppression. And I think that we need to start really leveraging the economic power that we hold to get people's attention and to affect change. And I'd say that the call to action is, let's commit to really addressing these pervasive issues that we're all experiencing. And above all, let's stay focused on addressing the systemic racism and the desperately needed changes and the progress that is needed in this, not just in this county, but in this country.
Thank you, Nancy, and thank you for joining us. Joanne, I see you're unmuted. You go.
Thank you. I was about to ask for a petition to be signed, but I'm happy to report that we have the attention of Nick Machon, the head of Health and Human Services for the County of San Diego. And he is making an effort with the help of an advocacy of Supervisor Greg Cox, Assembly Member Todd Gloria, Council Member Chris Kate, and also I will say Council Member Monica Montgomery. I've talked extensively with your staff, and that's helping to push for disaggregated data, scheduling for testing with the mobile Live Well unit. So since that is in motion, and I hope we will see the numbers change as far as disaggregated data and knowing our true numbers. I hope that comes fairly quickly. So my call to action is what's right behind me, the census. I'm asking all of you to remind your family, your friends, your throughout the US, the territories of Puerto Rico, Guam, and America Samoa, be counted. There's only 9 questions. And when we talk about racism and we talk about inequities of programs, services, and budget, it stems from the census that's taken only once every 10 years. There's only 9 questions. my2020census.gov. If you haven't completed your census yet, please do so right after the broadcast. Thank you.
Thank you, Joanne, and thank you for joining us. Genevieve.
I have two calls for actions. One is a little less concrete. I want us all to commit to not going back, that we will all take action, because right now we're in a place where we need more than thoughts and prayers, and it is going to take all of us together. And so I do want to acknowledge everyone who was a part of this dialogue, every single person. We were up to 310 attendees. And we really do all have to come together in this and to remember that. And so I want us all to reimagine what our society can look like, what it should look like, and then work together to achieve that. My last call to action is read your city's budgets. We talk about budgets being value statements. We're talking about in the city of San Diego having our biggest deficit in our city's history. Look and see what the mayor is putting forth. Look and see what's not being funded. Look at your city's budget. I encourage everyone to be a part of these public hearings. It is so easy now because of COVID-19 and social distancing where we can call in to public comment. There is so much to say, but when we talk about a $27.2 million increase to a police department, when it could be going to schools, parks and recs, libraries, nonprofits, small businesses, we've really got to reprioritize. And so dig deep into the business of the city, because it's our money and it's our business.
Thank you, and thank you for joining us. Councilmember Weber.
Well, thank you for having me this evening. If I were to leave with one note, I would say that just make sure to continue to be an advocate. Advocate for yourself, for your community, for your health. Don't let this just be a moment in time. Let this move us into a better city, a better state, and a better nation. I want to give a small shout out to Dr. Rodney Hood, because for a long time I was wondering, why are there no testing sites in Southeast San Diego? And he took it amongst himself to form a task force and to work with the county to open up a COVID testing site in Southeast San Diego so that people would have the opportunity to get tested in their own community. And so that's what you have to do. You have to continue to always advocate for yourself, for your community, and for your health. And make sure to tell your friends that they need to advocate for you as well, that don't look like you. You guys can't just go out and have fun and drink and party together. They need to be a part of the fight as well. So that's the one thing that I would leave everybody with.
Thank you, and thank you for joining us. Councilmember Montgomery.
Thank you, Cheryl. I'm honored to be on the panel with these ladies, powerful ladies. Just two things. One is, as we move through, and this kind of goes to the question about, what can white people do, but it's all of us. These are matters of the heart, and it's a lot of reflection on how we treat each other. And so I think just in that everyday, our everyday interactions, I want you to give, and I appreciate you giving, but I've been at a fundraiser where, a person gave a lot of money and still talked a lot of mess about a Black woman. That was me, and so I think that translates into dehumanizing each other. And so these are matters of the heart. We really have to reflect on where our hearts are. So that is one thing. And the other thing, of course, Genevieve mentioned it. We're going through our last budget hearing. It is June 9th. You can call into the city and check the city's website for the docket, and we need to call in. And we are going to hear that the Independent Commission on Police Practices on June 23rd. And so those are two big things that are coming up. And I would invite you to be a part of those conversations.
Thank you. Thank you very much. And thank you for joining us, Councilmember Montgomery. Before we hear from Christy, who I know is going to give us some powerful things to think about, I want to invite you all to join us next week, same time, 6 p.m. We're going to be talking about decarceration as a response to COVID-19. And when you leave the webinar, there'll be a short survey, very short survey that we hope you'll take so we can make sure that we're improving what the information that how we share this information with you. So Christy Hill, talk to us.
Thank you. And just echo the appreciation for all of you for being on the panel with us tonight. Really honored, and the words that were shared, I hope that folks don't just listen to them and feel good about participating in a conversation about racial justice and equity, but actually take to heart the actions that folks have said on this panel. For the actions that I want to lift up, it is budget season. And so we are part of the Community Budget Alliance, and there are a set of COVID-19 demands. And so hope that folks can support those. One of those demands is around ensuring that there is internet access for all during this time. So we know that the digital divide is a big issue, and not only affects students, but we're expected to work from home, those of us that can, right? And if you don't have good internet, you are cut off not only from work, but from ordering groceries potentially. And so we are calling on our cities and our county to invest in free internet in a way that protects privacy, and to offer devices that allow folks to access that internet. So we will put a link in the chat, I think maybe to the Community Budget Alliance demands. And then, you know, we've talked a lot about over the course of the evening about police accountability. And so one of the coalitions that we're a part of is the Coalition for Police Accountability and Transparency. And working with community members and partners, we have developed 5 policy reforms that we believe will limit police interactions in communities, reduce police violence, and divest from the police budget into interventions that are community-based. And so we hope that folks will take action and email your elected representatives to encourage them to adopt all of these practices. There are 5. The first would be a law that would limit when police can stop and search you. The second is about decriminalizing certain low-level offenses and instead investing in non-law enforcement interventions. The third is creating a strong de-escalation policy. The fourth, creating strong community oversight boards. We heard tonight from both council members that there are efforts going on in their cities. So please support those and advocate for them in your city as well. And then the last thing is to ensure that there are strong use of force policies in your community that not only include a chokehold or carotid restraint ban, but also include things like a duty to intervene and other pieces. And so we ask that you go take action. There's a link that should be in your chat now, and send an email. And so those are some of the actions. And then just lastly, the pandemic has allowed for folks to participate in really unprecedented ways because our government has become more accessible through virtual meetings. And so participate, you know, show up, call, send your e-comment. If you're wondering how to do that, you can visit your city's website, but you can also visit the ACLU of San Diego's website. We have a link that has all of the public comment procedures for every city in the county. So please visit, and also in Imperial County. So please visit that and participate because your voice matters right now. We need everyone to show up. This should not fall on any one community. Thank you.
Thank you, and thank you, everyone. There are still some questions in the queue, but we are going to follow up on those later. You have for those of you in our audience, please know that there are links to these recommendations. You can continue to follow our work on our website, and that information has been shared. I feel like this is a great moment for all of us to take a pause and recognize that it's on us. There is no one else. It is on us. And And to our panelists, thank you for joining us. To our audience, thank you for joining us. Thank you for the work that you will commit and will carry out to close this gap between peoples. We're wrapping up. Take care. Goodbye. See you next week.